Hi, my name is Shloka Nath, and my review paper is investigating why female collegiate level rowers tend to sustain knee injuries at a much higher rate than their male counterparts. So, what is rowing? Rowing is a team-oriented water sport where athletes use oars to propel forward a boat. And then sweeping and sculling are the two types of rowing. Here in the pictures, you can see I'm sculling because I'm using two oars, but sweeping would be if you were just to use one longer oar. And despite what most people think, rowing isn't purely just arm strength. The quads, the glutes, and the lats are just as important. And because rowing involves such a repetitive motion, you're going back and forth on the slide. That's why rowers are so prone to overuse injuries. And while overuse injuries are very common amongst rowers, female athletes are disproportionately negatively impacted. And we can see here that females are 6 times more likely than males to injure their ACL, and that the rate of patellofemoral pain syndrome is only 1.1% in males, whereas it is 12.7% in female athletes. So let's get into what is causing this disparity. First off is anatomical differences. So females tend to have wider hips and pelvises compared to male counterparts, and this is what predisposes them to a greater Q angle. And the Q angle is going to be the angle between the quadricep muscles and the patellar tendon. And as you can see in the picture on the left, you can also see that the female's Q angle is on average larger than a male's Q angle. So the Q angle ranges from 11 degrees to 20 degrees in females and 8 degrees to 14 degrees in males. And off the bat, you can already see that females tend to be on the higher end of this scale. And a Q angle between 13 and 18 degrees is what would be considered normal. And because a wider pelvis results in an increased angle between the bones and the knee joints, first off, females are already predisposed to this increased angle. And also, while they're rowing, additional stress is placed on the knee. Another factor that plays into this that is specific to females is estrogen. Estrogen is a major female hormone and it's known to instigate laxity. So what essentially happens is that the estrogen relaxes the ligaments and the tendons, and since the purpose of ligaments is to prevent excessive motion in the knee during swift movements, such as like during the rowing movement, the ability of the knee to support the ligaments is, or the ability of the ligaments to support the knee is compromised, which increases the likelihood of ACL tears. And then female estrogen levels peak preceding ovulation, and this spike relaxes the ligaments and tendons, which put female athletes at an even higher risk for injury during these times. So next up is strength imbalances. So what is a strength imbalance? It refers to an uneven distribution of muscular strength, which basically means that there's a weaker group of muscles, and that group of muscles that is weaker is going to be more prone to injury. And in the context of rowing, muscle imbalances occur when muscle groups such as the quads and the glutes are considerably stronger, whereas hip flexors and hamstrings remain underdeveloped. And these four groups are a key in the rowing movement. So the HQ, or hamstring quadricep torque ratio, is a very important index when evaluating muscle strength imbalances surrounding the knee joint and in general the knee joint stability. A low HQ ratio is indicative of potential injury to the ACL because what it essentially represents is a weaker hamstring in comparison to the quadriceps, which reduces the muscle's capacity to stabilize the knee joint throughout its full range of motion. And then female athletes are more likely than male athletes to exhibit a low HQ ratio. And one of the reasons for this could be that males' hamstring peak torque has been shown to develop considerably past puberty, whereas females' torque tend to plateau. And where the issue arises is that at a high velocity, such as during competitive rowing during races, females increase their HQ torque ratio at a much lower rate than males. And at low velocities, again, these differences are not very significant, but during higher knee flexion velocities, like during rowing, during races, the increased stress leaves the ACL very vulnerable, leaving female athletes more vulnerable to injury. And comparatively, males have a higher HQ ratio during angular velocities, so their hamstrings are able to counter the force of the quadriceps and effectively stabilize the knee. Whereas females' hamstrings may not be able to provide the necessary resistance in response to the quadriceps, which explains the low HQ ratio and explains why they're so vulnerable to these injuries. So, in conclusion, while anatomical differences like pelvic width and the Q angle are largely inalterable, muscle strength imbalances and their resulting injuries can very well be prevented through preventative strength training, which targets specific muscles and can be used to mitigate strength imbalances. And a huge reason why ACL tears occur is because women are unable to counter the force of their quads during high speed motions because of strength imbalances in their hamstrings, which again goes back to the low HQ ratio. But plyometric training has been shown to increase the HQ ratio of female athletes, and adopting more preventative training measures for strength imbalances specific to female athletes would be beneficial to reducing the overall number of injuries. Thank you.
Great job, Shloka. We have some questions and that have come through for you. One of the questions is, this is an interesting topic. What promoted you to do this research?
Well, I've been rowing for 3 years so far. So I'm like surrounded by a lot of women on my team who also go through similar struggles, going through different injuries, and seeing other people go through that kind of inspired me to figure out why female athletes are just so much more like subject to these injuries, whereas I don't see that much. I don't see this as much on the male side of my team. So that's kind of what inspired me.
Wow, that's awesome. How long have you been rowing?
3 years.
Oh, very cool. Well, it was a great presentation, and thank you for your time today.